Senator Urquhart.
Thank you, Mr Acting Deputy President. I rise to speak in support of the Tobacco Advertising Prohibition Amendment Bill 2010, a bill that will remove an ambiguity in current legislation that allows advertisements for tobacco products on the internet and in other electronic media. This brings electronic means of advertising, whether on the internet or by mobile phone, in line with restrictions already in place for other mediums. Tobacco smoking remains one of the leading causes of preventable death and disease amongst Australians. Smoking kills over 15,000 Australians every year and costs our nation over $31 billion each year. Australia has much to be proud of in this area. Sustained and coordinated actions from the Australian and state governments have seen smoking rates cut in half over the past 30 years. Now only about 15% of Australians smoke daily. I am pleased that all levels of government have committed to reduce the harm caused by tobacco and aim to lower smoking rates to 10% by 2018. This is a commitment to not only give Australians support to help kick the habit, but importantly to seek to prevent Australians from taking up smoking tobacco in the first place. The bill will make it a specific offence to advertise or promote tobacco products on the internet and all other electronic media and future technologies, unless compliant with state or territory legislation or Commonwealth regulations. Consider that in 2009, 79% of young Australians were regularly accessing the internet. That is 4 in 5 young Australians having regular access to a medium where there are no controls and no regulations over the advertising of tobacco products. This exposure, of which I'm told includes the glamorising of tobacco products in such a manner that makes them subconsciously appealing to young people, could lead to a curious puff in the playground and a terrible addiction. If we can limit this exposure and this perceived normality of tobacco smoking, we will limit the damage done to young Australians. In 2010, approximately 4% of teenagers smoked tobacco. This is 1 in 25 children, or at least one child in each high school classroom across this country that regularly smoke tobacco. People who start smoking when they are young are more likely to smoke heavier, to become more dependent on nicotine, and to be at increased risk of smoke-related illness or death. And more people tend to smoke in lower socio-economic regions of the country, such as parts of my home state of Tasmania. In the 2010 National Drug Strategy Household Survey, Tasmania was one of the 2 states to record a statistically significant decrease in the proportion of daily smokers over the period 2007 to 2010. The rate was down over 6.5% from 22.4% to 15.9% of Tasmanians. This is the first time in 10 years that Tasmania has recorded a decline in the proportion of people smoking daily. There is still much work to be done though, as unfortunately there are some worrying statistics in this report for Tasmania. The proportion of daily smokers, while down on 2007, is the 3rd worst amongst state and territories. More than 500 Tasmanians die each year as a result of smoking. Alarmingly, in the 20 to 29-year age group, over 25% smoke daily, the 2nd worst rate in the nation, only marginally behind the Northern Territory and a lot higher than the national average. These people grew up during the 1990s after the Act was legislated. Tobacco advertising and sponsorship was being seriously wound back in Australian society when they were children. These people also became adults after it became mandatory for graphic health warnings to be displayed on cigarette boxes. Now, this figure is down from a constant rate of about 1/3 of this age group through the 1990s and 2000s, which is a positive thing. The measures that Australian and Tasmanian governments have put in place are working. However, we must continue to make positive reforms and invest in positive programs to see this rate decrease further. Alarmingly, a large number of Tasmanian women, around 24%, continue to smoke during pregnancy. This is not only a major concern for the health and well-being of these women, but also the impact on babies and small children. This bill is part of the Gillard Labor government's comprehensive anti-smoking action package. headlined by the mandatory plain packaging of tobacco products, which passed the Parliament last year and comes into effect later this year. This is the latest package in a 40-year effort to inform Australians about the harm of tobacco smoking. Reforms to tobacco advertising started in 1973 with the banning of tobacco advertising on television and radio and introduction of mandatory health warnings on cigarette packets. Then in 1989, tobacco advertising was banned from newspapers and magazines. The Keating government introduced the Tobacco Advertising Prohibition Act in 1992, which sought to ban tobacco advertising in this country. The Act makes it an offence to give publicity to or promote tobacco products, but is not clear in its application to internet and mobile phone advertising of tobacco products. Since 1992, the use of the internet and other electronic means of advertising mediums has increased, and there is not much point in regulating other forms of advertising while allowing tobacco to be advertised on the internet and mobile phones without regulation. This unregulated loophole also undermines the effectiveness of the rest of the Act and fosters the false perception that smoking is the norm. Several Australian websites sell cigarettes, while there are many where advertising is prevalent. Those retail sites often do not post health warnings, nor do they comply with state and territory-based legislation surrounding point-of-sale advertising. I've come across Australian websites that offer large discounts off boxes of cigarettes. Now, on these websites, all of the packets are neatly presented, except there are no health warnings, let alone graphic health warnings to be seen. It isn't until you try and purchase a box that the not for sale to Australian residents note appears. Those websites export Australian-made cigarettes across the globe. But the glamorous advertising is the damager here, and it is the crux of this bill. My concern with this website is the ambivalent manner in which the health effects of tobacco smoking are treated. The advertised labels are a throwback to the 1960s, where no health warnings were displayed at all. As these shops are on the internet and currently not covered by the Act, they don't have to show appropriate graphic health warnings, and they are able to show the packets in all their glory. This legislation will remove this loophole. A content analysis study of pro-tobacco websites revealed that only 11% of the sites contained health warnings. The pro-tobacco sites frequently associated smoking as glamorous, with images of attractive young males and females. This raises concern that young people who may not have seen a cigarette packet before stumble across these websites and interpret the pictures as a norm. They may not understand the effects of tobacco smoking. We must provide them with the same amount of protection from tobacco advertising as is provided through other mediums. People do not need to smoke many cigarettes to become addicted to smoking. Young people can be at risk of becoming addicted to smoking even if they only smoke occasionally, such as at parties or on holidays. Tobacco smoking is the single most preventable cause of ill health and death in Australia, contributing more drug-related hospitalisations and deaths than alcohol and illicit drug use combined. Diseases such as lung cancer and heart disease tend to occur in people who have smoked tobacco for a number of years. However, there are immediate and obvious effects from smoking just one cigarette. If a person has not smoked for 12 hours and then has a cigarette, the following things may happen. Carbon monoxide levels in the lungs increase. Vision and perception can be impaired. Coordination slows and risk of accident increases. Nicotine from tobacco smoke reaches the brain and muscle tissue soon after being inhaled. When nicotine is present, a number of changes occur. The heart rate increases, blood pressure increases, this lowers skin temperature, hand tremors before and after a cigarette, stomach secretions increase, and brain activity spasms. Tobacco smoke increases resistance in the airways leading to the lungs and reduces lung capacity. This is why most smokers have heavy coughs and often struggle to walk up a small hill. Tobacco smoking is a leading cause of emphysema and chronic bronchitis. Emphysema or lung rot is a degenerative disease of the lung tissue. It destroys the tiny air sacs in the lungs slowly over many years. The lungs cannot repair from this damage. Chronic bronchitis is the excess production of mucus in the lungs' air passages. This bill seeks to go some ways to stopping young, indeed any Australians, starting to smoke tobacco or return to smoking tobacco. Lowering smoking rates will lower the rates of people who are affected by these health problems I've just outlined, and I commend this bill to the Senate.
Thank you, Senator Urquhart.